Cancer has been around for a long time. The earliest signs had been found in fossilized tumors and mummies from Egypt. Egyptian papyrus writings addressed tumors that were removed with a fire drill and concluded that there was no treatment for them. There has been a slow progression of cancer treatment over the centuries, and recent advancements in screening techniques have enabled us to treat it more effectively through early detection. Cancer's presence is felt among everyone. These statistics are the baseline that Healthy People 2020 is projecting to lower by 10% in 2020. As you can see, a significant proportion of Americans died in 2007 to cancer, 178.4 per 100,000. With this kind of statistic, we have all probably been affected by someone's death and could be diagnosed ourselves with cancer in our lifetime. Therefore, it is in our best collective interest to actively contribute to the progressive evolution of cancer detection, treatment, and quality of life for cancer patients.
At the pharmacy, we provide many services that can be categorized as provision or advocacy. Provision is defined as providing health screenings, providing disease management services, and providing immunizations. Advocacy can be defined as distributing brochures and other patient education materials, distributing risk assessment quizzes, and demonstrating how to use pharmacy devices and medication delivery devices such as inhalers. For lung cancer, we can provide smoking cessation programs, which is an active participation, also known as provision, and for advocacy, we can distribute pamphlets. For uterine cervical cancer, we can provide the HPV vaccine, which is an active participation on our part, also known as provision. And for advocacy, we can advise seeking screenings such as pap smears and women's wellness checkups through pamphlets. For colorectal cancer, we can offer easy take-home tests, which is provision, and we can give educational materials to encourage follow-up care from other health professionals. For melanoma, we can check moles, sell sunscreen, and give assessments, which is active provision. And for advocacy, we can provide pamphlets on effects of sun and tanning beds on the skin. Overall, we can provide counseling for cancer patients and family members on their medication therapy and what life will be like with these medications. This could lead to better medication adherence and outcomes.
And I would just like to add to what my colleague said about advocacy. We as pharmacists can provide educational materials such as warning signs, risk factors, and what questions patients should ask their doctor regarding cancers like breast cancer, oropharyngeal, melanoma, and prostate. In addition to educational materials, we can promote local awareness events and activities like the Walk for the Cure for breast cancer, or wearing the pink ribbons, or something like No Shave November for prostate cancer. Another thing pharmacists are positioned for is facilitating screening events. Facilitation means bringing in another healthcare professional to provide some screening events that would be beneficial for our patients. Pharmacies that have space for screening events definitely have the ability to accomplish this. For example, breast cancer, we could bring in a nurse to provide checks for women to check for lumps, since it is important for women to be checked every year, and the pharmacy is a very accessible place for many patients. And for oropharyngeal cancer, we could organize an event for a dentist to come and check for signs of the cancer. And for melanoma, we could bring in a dermatologist to check for abnormal spots and let patients know whether or not further testing should be done. All of these, provision, advocacy, and facilitation, could lead to a reduction of deaths from cancer because early detection is key to effective treatments. Since pharmacists are very accessible and we already contact other healthcare professionals on a regular basis, this would be a great way to help our patients by simply using our knowledge and skill.
Although there are devices for screening and educational tools for counseling, pharmacists have not been active in implementing preventative services for cancer. For example, stated in the Journal of Clinical Pharmacy and Therapeutics, data obtained from 128 pharmacists indicated that the incidence of skin cancer prevention counseling was very low, with over 1/3 stating that they never counseled patients on the topic. Of those that did counsel, the percentage of patients counseled on skin cancer prevention was below 5%. This being said, pharmacists need to significantly increase their involvement in cancer preventative services so that more can be accomplished.
Pharmacists need to be provided with the proper training and education, and since there are so many different types of cancer, it would need to be very specific. A lot of cancer screenings are not very feasible in an outpatient setting unless we bring in other healthcare professionals. And it would also be important to figure out what kind of cancers to screen for. It would depend on the community that you're working with, and we would need to look at the population demographics and things such as age, sex, gender, and other things like socioeconomic status and the level of education. It would be important to find funding for these events. They could be expensive, and it would be important to make sure that there's a reasonable cost to benefits ratio. And next, we would need to promote the event very well and make sure that it's well advertised around the community to make sure that everyone can figure out about it through radio, TV, newspaper. We would need the proper facilities. It could potentially be hard to find privacy inside of a pharmacy, which would be important for the patients. And there also needs to be quality control with the screenings. And if someone is at risk, we need to provide some sort of follow-up for that patient or a referral system for them. But most of the time, screenings aren't very feasible. And another important thing to remember is that we absolutely cannot diagnose patients with. We are easily accessible to those patients who may not even know about the risk factors for certain cancers. For example, for pharmacists working in urban areas, there's going to be a lot of minority groups that may not even realize that they're at risk for something because maybe there's a language barrier, or maybe groups that have a lower level of education, and they could just happen to walk into the pharmacy one day and they could potentially learn a lot about themselves. Pharmacists can provide a lot of information on cancer awareness. We can deliver self-assessment tools, risk assessments through computer or paper, and we can even distribute pamphlets. Pharmacists can also provide individual patient counseling for each person that we're screening. And we can provide education to those patients that may be uninsured and they don't even have a primary physician. We can also recommend over-the-counter products. For example, for someone who's at risk for skin cancer, we could suggest for them to use sunscreen if they're exposed or out in the sun a lot. And pharmacists have already begun playing an even bigger role in colorectal cancer, skin cancer, and breast cancer.
Since the objectives are all geared towards reducing the rate of each cancer, pharmacists can have a huge impact on cancer research. Drugs are constantly being formulated and developed in the fight against cancer. Pharmacists can use their extensive knowledge in drug development and mechanisms of action to contribute to this battle. For the pharmacists not involved in laboratory research, such as community pharmacy, they can help patients cope with cancer. Cancer medications can have very severe side effects, and pharmacists dispensing in outpatient settings can help people remain comfortable during these tough times. Not dealing with physical pain, pharmacists can help with the emotional side of cancer. They can provide constant support to the patient and their families, as we are one of the most available health professionals. This will help increase the mental and physical lifestyle of cancer patients and survivors. Any research that pharmacists can contribute to will help increase the number of survivors past 5 years of diagnosis. Pharmacists can also participate in funding for this research. They can get involved in community events such as Relay for Life and even set up fundraisers at their own stores. They can take proactive stance in increasing the number of population-based registries that capture case information on at least 95% of reportable cancers. Right now, there are only 42 states, and one objective is to increase to all 50 states, including the District of Columbia. Overall, pharmacists can contribute a lot to have a meaningful impact towards achieving these specific objectives towards the focus area of cancer.